Hi, Ms. Joe. My name is Elizabeth, and I will be your nurse today. I wanted to take a few minutes to talk to you about a medication you'll be receiving later today. It's called Doxorubicin or Adriamycin. Doxorubicin is a very strong chemotherapy drug and is known as an anti-tumor antibiotic. Its main job is to target and kill rapidly growing cancer cells. This medication is basically going to insert itself into the cells of cancer and block the DNA from making new genes. This prevents them from dividing, and instead they're going to break down and die. It also creates a chemical known as free radicals, which are basically just going to add to that cancer fighting ability. Doxorubicin can be used for all kinds of different cancers like breast cancer, leukemias, lymphomas, bladder cancer. So it can be a really great option for certain circumstances, but there are some serious risks that I wanted to go over before, just so you have some information. So one of the main things is going to be hair loss. It's temporary, but I know this can be very difficult to overcome. So of course, just let me know if there's anything I can do to help. Heart damage may also occur. So this just means the way your heart works may be affected. We will be watching your heart before and during treatment with different monitors. But if you feel something like shortness of breath, chest pain, or swelling, we would definitely want to know about that. There is also something called bone marrow suppression, which means your blood counts are going to lower. The main thing we're concerned about here is infection, bleeding, or anemia. You will be having blood work regularly, but you should let us know if you feel unusually tired, if you notice any abnormal bruising, or develop a fever. Nausea and vomiting are common with doxorubicin, but you will be given anti-nausea medications before the infusion, so hopefully this will do the trick. And then lastly, it can cause some tissue damage to the site around the IV, but we will be checking your sites hourly, so hopefully this won't occur. But again, if you feel any burning, pain, or swelling, just be sure to let us know about that. If doxorubicin doesn't seem to be a good match for you, there is also a form of this drug called liposomal doxorubicin, or Doxil. So this drug does have a reduced toxicity, so it may yield milder side effects, but it does have some serious interactions at the infusion time, so we will definitely hold off on this until absolutely necessary. And lastly, I just wanted to make you aware of a super rare but serious condition known as tumor lysis syndrome. This happens when a large number of cancer cells die off quickly. We're mostly concerned about it leading to problems with your kidneys, heart, or blood makeup. So we'll be keeping an extra close eye on you, especially after these first couple of treatments. That's pretty much all I have for you today. If you have any other questions, feel free to contact us. We're more than happy to help. And if you notice any new symptoms, of course, let us know, okay? Thanks so much.